Thanks.
I think I can echo, there are a lot of themes that are here that definitely run through our MDR-TB partnership too, that I can echo. With a little bit of history about our program, this is a very broad program with 18 partners in 60 countries. And the history that comes to us developing this program is that Lilly is a 135-year-old company. We've got a long history in the pharmaceutical industry and a long history and commitment to philanthropy through our endowment that has been very generous over a number of decades, and then that has now spun off, and we have a foundation that's now still within our company that is also generous. But over the last decade, we realized we wanted to do something a little bit different. We'd been giving cash donations to various things in support of the communities around us, but knew that those aren't always sustainable, especially in economic times. You want to find something that will last over a long period of time, and also that would speak to our expertise that we have in-house, which is tremendous. We are a high-tech R&D company with very skilled employees who want to provide their expertise in areas in addition to helping patients on a daily basis, which is how we feel about our contributions and our work, but also in the developing world and around in other places where it's not something that has always been on the forefront of how we think about our work when it started as an American company and branched out. So we have that tremendous expertise, and we thought, well, what can we do? About 8 to 10 years ago, the access to medicines debate really kind of took off, and it was all directed towards AIDS, malaria, and TB. And we happen to have 2 drugs, antibiotics, that are very effective still in treating a number of very complicated strains of TB. And we thought, well, we've got these drugs. What else can we do? We've got an expertise that we would like to transfer to the developing world. And we thought, well, we could do this by ourselves, but it would be nice to be able to reach out with partners and really create a very complex and compelling program that would be sustainable over a long term, and that we could see broader outreach than just giving a cash donation, which isn't always sustainable. So we developed a program with our 18 partners that deals with transferring the technology to make those 2 drugs to 4 different companies in the developing world, in China, in India, in South Africa, and in Russia. And we've been working on that transfer of technology for the last 6 years. We're continuing that over the next 3 years and hope to complete that very soon so that these companies themselves can make these drugs themselves and then hopefully export them outside of their markets. We've been working with Purdue University and with Harvard to help those companies to develop the good manufacturing principles so that they can get the certificate they need to be able to export this outside their countries, and also to be able, it's obviously a good selling point within their country, which is all 4 of those are high-burden TB countries. And so there was a good message there that we thought that made a lot of sense. And then we also, because TB is a very complicated disease, if you don't take your full treatment, you end up creating additional drug-resistant strains. And so you can't just go and drop drugs and say, hopefully they'll take their full regimen and be cured. It doesn't work that way in a lot of these countries. We need to train healthcare providers, doctors, and nurses. And a number of our partners are the Red Cross and the International Council of Nurses. We've worked with them to help create programs that train healthcare workers on the ground on the location so that they can make sure that those drug regimens are completed by the patients that take them so that we don't continue to create additional drug-resistant strains like XDR-TB that we're starting to hear about a lot. So we did that. We've also been partnering to we work with the WHO to donate drugs in addition to help them meet their targets with the goals that have been set globally for TB, and then we'll also be working with teaching folks how to communicate about TB going in their countries and globally. So those are the things that we looked at. We thought were very constructive and long-term sustainable. They spoke to our expertise in-house and helped us, back to this, the morale question or the morale point it's been highly motivational for the people in our company. Because it's back again, we're doctors, a lot of people are doctors in our company, our researchers are compelled to help patients and really want to help patients, and this is an additional way that they can do that and feel that they are really doing even more good than they feel they do on a daily basis anyway. So it's highly motivational, it's a very big retention tool, it's a very big recruiting tool, and we do feel too that you can do well by doing good, and that our industry obviously has image issues occasionally, and we feel that we, as every other company, has a responsibility to be, contributing back to society, and this is our effort to do that.
Thanks, Desiree. So we've had some great examples of putting those accountants back in the back room to really work on using your core competencies, talked a lot about how these programs can really energize people, either through exciting Twitter approaches or even in your own companies, going down deep and tapping into what people want to give. Karen mentioned something very important I want to come back to towards the end about how you create business opportunities, and we're going to come back to that towards the very end. But you also mentioned, Desiree, partnerships, and that's a pretty important topic, and I wonder if you could explore a little bit, and then I'll ask others to jump in about how you move. Many companies have moved to a more partnership approach. Some of those you've done with TED, also with non-governmental organizations. And then I actually want to come to you, Richard, about that shift wasn't without cost to the companies from a public relations standpoint, and how going forward the risks to companies to partner might affect their public relations image, or how they capitalize on those partnerships for a public image. So can you tell us a little about your partnerships, and then ask the others, and then I'll come to Richard to ask about the branding issue effectively.
Well, public-private partnerships are kind of the buzz, specifically in the global health arena right now, and I don't know if that's the case in the other areas that you all deal with, but certainly in ours. And partnership is in the name of our program, which is MDR-TV Partnership. We have 18 partners that we've been working with, and those are in academia, as I mentioned, with Purdue and with Harvard, who also bring the expertise that we wanted to support the expertise that we had. We felt that was very important. We also reached out to NGOs that are hands-on on the ground, as I was saying, dealing with, working with the nurses and healthcare providers on the ground, training them to be able to complete these regimens and do that in the right way. We've reached out to the partners with, again, the International Council of Nurses, which is a very grassroots organization doing much of the training here. We also have the International Committee of the Red Cross and the Red Crescent, which is a tremendous organization, very broad-reaching, that could help us as well to reach out to the 60 countries that we're engaged in here to help combat this really horrible disease. And then in addition, we've also, with these companies, I mean, it's, as I said, a very complex program that transferring the technology, we consider those companies in these developing countries our partners, and so they very much are helping us to meet the goals that we have set for this program, and also to help the WHO reach the goals that have been set globally. So we feel it's very much, you get more by working with partners. Hopefully they're getting benefit from working with us, and we feel that they do. They seem to be, we get a lot of very positive feedback. They're very happy that we're helping with these efforts. So and we're very happy to have their expertise and help as well. It's just, it's the right way to go about these things, to address it in a comprehensive way and to solve the problem. If you don't do that, I think you end up with the stopgap solutions and the non-sustainable approaches that don't help address these very complicated issues in this space in particular. So it's been the right way to go for us, and we feel in particular we're looking to develop a new program for our CSR activities globally, and we'll hopefully be rolling that out here in November, and we're hoping to have that address diabetes, which is another area within our company that's an expertise of ours, where we were the first company to bring animal insulin to market. And so we have a long history in the diabetes space. We have a tremendous amount of expertise. We're going to build a program around that, and again, be reaching out to a number of partners that we've been working with for years to help bring their expertise to the table so that we can combat what is an incredibly complex issue as well in its own right. So we feel that those are the most successful ways to address these challenges.